Welcome to Health System CIO's interview with Trevor Brown, Deputy Chief Information Security Officer at Yale New Haven Health. I'm Anthony Guerra, Founder and Editor-in-Chief. Trevor, thanks for joining me.
Nice to be here, Anthony.
All right, very good. Let's start in. I'll ask you about tell me a little bit about the organization and your role there.
Sure. So currently with Yale New Haven Health, we are about right around 30,000 employees, primarily focused in Connecticut as Connecticut's largest healthcare system. We have five main hospitals and probably around 350 offsite locations. We're also expanded into Rhode Island and New York, and always like companies our size in the healthcare space, looking at pick up acquisitions where we can. In terms of the security group, we have about 40, 45 people in security, primarily focused on risk and audit, identity access management, cybersecurity, and security architecture.
All right, very good. I want to start with sort of an open-ended question, just see what's on your mind. What are you thinking about these days? Any big trends you're looking at, big projects you're working on? So what's sort of top of mind for you?
Yeah, so there's a few tracks. I mean, one on the actual tool side. I mean, we look to use best of breed tools. So we do shift from time to time, and there's usually a project ongoing in that space. One initiative that I've really been pushing this year is end user training. So a lot of organizations, they talk about end user training, but we're really pushing it to the point of going to locations, meeting with department staff before their shift starts, providing that user training on the spot, and also pushing out quarterly phishing and really making sure that those users that are failing are provided with the proper training. So that's something that we really want to push, just because the prevalence of ransomware, any type of malware coming in through email is so prevalent that your weakest link is your actual user base. So just clicking a link can be could be catastrophic. I mean, hopefully it's not. We have some pretty good tools in place and people, but really pushing that training out.
Okay, very good. Let's talk a little bit more about the training. Is this a mandatory type thing? So, people come in and usually there's training upon starting,
Yeah.
and that's fairly easy to arrange. Um, and then there's the idea of after they've been on the job a while, is there periodic training or there specific things you want them trained up on? Is it mandatory? And then, we can get into the idea of, there's supposedly quite a bit of turnover out there, and there should be a uh, good working relationship between HR and security. So, when people leave,
Mhm.
around identity
Yeah.
management, right?
Mhm.
Adding permissions and also removing permissions, and then making sure that things are revoked when they leave. But let's start with that training and tell me a little bit more about that, what you want to cover, and then whether it's mandatory, periodic, or whatnot.
Mhm. So the one annual training, we have an information security and compliance training that is mandatory. We just did a full revamp of the program. It hadn't been updated for over almost 4 years now. So we just did that, and then we rolled that out this year. And then we have the quarterly phishing training as well. So if you fail that, then you're brought into our learning management system for required training. So it's kind of that two-pronged attack. Uh, Around identity and access management. So we're very good at obviously onboarding, pretty good at terminations. The area that I won't say we struggle, but I think like most organizations, definitely all the big organizations I've been at, it's around the transfers that sometimes you transfer, something happens along the way that they maintain their old permissions, and then you have that type of privileged access internally. We have done a lot of work in that space, but that's always something that we're looking to improve on.
And that's because of the size of the work staff and the amount of changes that happen, right? I mean, there's changes all the time, especially in healthcare. People are moving around, sometimes temporarily, sometimes
Mhm.
to handle, certain need in certain area. And then there has to be that communication, right, with security. So,
Exactly.
so tell me a little bit more about that. That's why it's hard to get your arms around it, right?
Yeah, we have a pretty good process. A lot is dependent on that HR. It's an automated feed that yes, this is the termination date, but sometimes those don't go in, or sometimes in most health systems they have a lot of non-employee users as well in their EMR systems. So you could be an outside provider and an employee of Yale New Haven. You leave as Yale New Haven, but you still need EMR access. And then there's a lot of very nuanced type of scenarios where, they need access for this, but not that. And it's kind of, then you get into a manual type of review by one of the analysts on the team.
And the goal there is to make the manual stuff as small a part as possible, because that could just be endless, right? Dealing with that.
Exactly.
Yeah.
Yeah. And we operate on the premise of minimum necessary. So minimum access to data, minimum privileges required to perform your job. We really push that minimum necessary.
Okay, so let's talk a little bit more about the quarterly phishing training. Any thoughts on that, or things you want to share about sort of doing that well and making it effective? And we've all heard sort of comical things about, you don't want to tell the employees everyone got a bonus, because then they get pissed off when they find out it's not true. So, so your thoughts around phishing?
Yeah, it's interesting. So when the early phishing emails came out, I mean, they're very recognizable. I mean, bad spelling and just the sentences didn't make sense. Now the phishing is so realistic that you get them and you're like, well, I'm expecting an Amazon package today. Is this it? Like, so uh, feedback has been mostly positive. Some users are like, this isn't appropriate, or I usually, I don't fail, but then we'll check, and they're one of those types of repeat offenders. Might be some pushback on actually doing that training, but we do portray that it is very important for the organization. It is required from all employees, and it's something that we try to push out and show the benefits of that training, so that obviously the security posture is enhanced as a whole across that 30,000 employee base.
So for most of the security folks I've spoken to in healthcare, there's a very big reluctance to look at anyone who makes an error as anything other than a victim. Um,
Mm,
so there's not a huge amount of desire for punitive action when people make mistakes, repeat mistakes. I don't know. What are your thoughts around that? Does that ever end that sort of benevolent approach? Does that ever have to get stricter to where there are some serious consequences? Because as you talked about the risk, I mean, yes, and
mm.
I want to talk a little bit more about the ways you mitigate the risk of a bad click, but it's nonetheless a risk. So your thoughts around that sort of, we know there's a carrot. Is there ever a stick in these things?
So there is, to some extent. I mean, it depends. I mean, we have HR policies and information security policies in place that if you were to do something, beyond, what we would deem as inappropriate, I mean, there's an offboarding process and a number of steps that would be involved. In terms of phishing, what we're doing is, we're building that out where the training's sent to the employee. And then if there's a period of time that goes by, then their manager is notified as well to have a discussion with them. So we found that that's quite helpful. I mean, sometimes it's the manager and the employee have both failed, right? So it's going to one level above. But uh, usually when you get something from your manager to say, hey, this, and we have a discussion with them. I mean, these are a small group that we're actually reaching out to at that point, and having that discussion and showing them the benefits. So when you have that discussion with your manager, usually you're going to do the training, and it's something, if your manager is speaking to you, that's kind of reinforced of the benefit from that.
Crafting these emails, these phishing campaigns, is this something you use outside help for, or is this something you try and design yourself? I'm thinking that it's probably a lot more difficult to do this properly as you get down to actually writing. I think in general, yeah,
Mhm.
we could craft a phishing email, but when you come down to writing it, you want it to be not too easy, not too hard, because I suppose, I mean, it could be so
Yeah.
sort of undetectable that nobody could be expected to
Right.
recognize it. But
Right.
what are your thoughts? I mean, how do you do that? How do you craft those?
Yeah, a lot of them. So we're saying, I mean, we do use a third-party tool that has, various templates that you can choose from. I mean, you can choose from ones. We did a holiday type phishing exercise where, they were like, your package is being delivered type. Uh, they also come, we have an external banner. So if emails are coming in, I mean, you are expected to know that, hey, is this external? Okay, that's kind of like your first. And I think the vast majority of companies have that in their email built in. That's kind of the first step of, a pause, I would say, from an employee perspective. And but yeah, the templates themselves, the tool we use is pretty good. There's a lot of standardized phishing type tools out there. I think they all offer pretty much the similar package where you can choose phishing templates and then you can choose types of escalation emails for those that fail. We build those in, and then that, I would say, that last 1%, then we go to a manual type process where we're working with them and making sure that they understand the benefit of the training.
Right. So that's one angle of creating the culture of security is sort of that
Mhm.
testing. How do you get people to care? What's the messaging there that here's why you should care? I mean, do you talk about outages at other health systems and how they've been down for weeks or months and how that impacts patient care? How do
Mhm.
you get them to care, uh, and to take an extra minute because they understand the severity of what could happen?
Yeah, so we do have those types of monthly, quarterly email blasts that go out, newsletters. Uh, Also, our approach when we're discussing information security is we deal with a lot of physicians, nursing, a lot of patient-centered individuals, and we really portray it and put it in a risk perspective because those individuals, they're dealing with risk every day with their patients. Should that patient have surgery? Should they not? There's risk to each of them. So we portray that from an information security perspective. And I think once you have those risk discussions, it really starts to click with the end users, and they do understand where you're coming from.
Very good. So you mentioned that culture of security. What might be sort of number two that's on your mind, either a trend or something you're working on, something you're looking at, trying to follow?
I would say the number two thing is really making sure that we're sound in the identity access management space, making sure that those users who no longer need access are terminated timely, making sure that any types of transfers that their access is provisioned correctly. And it's really streamlining those processes. So that's a big initiative that we have is around the user access space. We also have a number of activities ongoing to support a lot of the patient-facing type areas. Uh, so we're embedding and working with the teams in those, and also from the employee experience viewpoint, making sure that whatever actions we're taking, that security is built into that. So there's a lot of working sessions with the various projects going on, and making sure that that right security person is involved.
And how do you manage to get there? That's obviously a huge thing. We talk about it a lot around third party risk. If a department or someone is bringing in a new application, that those have to be checked by
Mhm.
security. They have to be looked at,
Yeah.
and we don't want to be brought in the night before you're supposed to sign the contract, right? So that's all around governance. That's all around communicating the role of security, coming up with processes that
Mhm.
people accept and understand and are willing to engage in. It's not the military, right? So we want people to want to come to. Here's why you want to come to security,
Sure.
and here's how you do it. Here's our process, and hopefully you're catching fewer and fewer things as they pop up on the network. Nobody came to you. Nobody told, what's this? Oh, now we have to go out. Oh yeah, it's a cloud app and I use my credit card, right? And so, how do you change the dynamic? How do you get that done to where security is brought in in a timely manner for these
Mhm.
things?
Yeah, it's definitely changed. So, I've been here over 10 years, and when, in that time frame, I mean, people didn't want security involved. They kind of wanted to just get their projects through because they knew there could be some, time holdups or certain type of requirements, extra requirements to delivering the end product. It Over that period of time, it's completely flipped where now no one wants to do anything without ensuring that it's gone by security for that check. And we've done a lot of work with our project management teams, and we have a really good intake process to make sure that projects are going in through that vetting channel and that the right technology groups, including security, is involved. That being said, are there ones that slip through? There always is, right? I mean, but I would say that number now is very, very limited. Uh, the number of kind of 11th hour, hey, we're putting this in tomorrow. Any issues with security? I mean, that's a rarity now, and I think that that's something that we built over time, and like any organization, it takes time for that type of culture to switch and change, where they see security as an asset as opposed to a hindrance. So we've really put a lot of work into that, and I think that it's really shown through the organization.
What is the usual method of finding something that someone has sort of purchased or turned on without the proper vetting?
Mhm.
Can you think of any ways that, it pops up on your radar? How does that happen?
Yeah, a lot of them, and they come in through other employees, either in the technology group or other departments. They might be detected through a number of our scanning tools that we have. Those are really the two main methods. I think it's really important to have those key contacts outside of the technology group, people that are aware in finance, compliance, other areas where a lot of times they'll come to us and say, hey, did you know about that third party tool? Or did you know about that new donation site that they're spinning up? And they come in and then we get involved. So having those, I would almost say like, allies from a security standpoint that are embedded through the organization that we work closely with really helps us.
Yeah, and I'm again from what I hear, that's a rather friendly. Hey, we saw you turn this on. We're here
Right.
from security, right? It's not a
Mhm.
sort of punitive. How dare you? It's a we'd like to explain to you how to protect the organization a little better. Is that the dynamic?
Yeah, it is for the most part. I think in healthcare in general, it's more cordial and more supporting each other. In some other industries, but I think once you do explain the benefits, then I would say the vast majority of people are on your side, and they want to make sure that whatever product they're rolling out is properly secure, both from a patient and employee perspective, but the organization as a whole.
So you mentioned that they're much more likely now to come to security. I think they understand they want that stamp for their own benefit that it's been
Yes,
stamped, right? They
yes.
don't want to they don't want to they don't want to be caught not having gotten it stamped. But they don't, as you mentioned, in the old days they were worried security would slow them down. So you want that to happen as little as possible. You
Mhm.
want to have an efficient process of responding to a request for vetting. So, hey, we want this app here, security, uh, whatever. Do what you either stamp it or don't
Yeah,
stamp it or let us know what he's doing. But it can't fall into a black hole
right,
where we don't hear from
right.
security for a month and then nobody remembers what we sent over, nobody can find it. Obviously, I'm exaggerating, but what do you want to do? What kind of service do you want to offer in that scenario
Yeah.
to your
So
internal person? Go ahead.
sure. We have a pretty well-defined security design review process. So we would work with we have a number of individuals internally that do reviews, and also we leverage an external company for some of the more technical, I would say, or technical specific reviews where we need to leverage outside expertise. And then built into that, we have questionnaires. We meet with, if there's a vendor involved, we'll meet with them, meet with the internal types of sponsors. And then we produce our end product as a risk assessment. And we have, if there's risks that are identified, we list those as, need to be addressed, implemented prior to the project going live, or they can be remediated after. And we have a review process, an annual review process where we go and we validate and we check and follow up on those risk issues.
And I assume you're seeing the gamut from the vendors in terms of some are responding quickly with exactly what you asked for, and maybe
Yeah.
some you don't hear back from. And then you may have to go back to your internal user who wants this app and say, we're not getting the information we need, or they're not responding back to us in a timely
Mhm.
manner. So, hey, maybe you want to reach out to them because they're not getting back to us.
Right.
I don't know if that
Right.
dynamic happens.
We have done that. I mean, we will escalate to our sponsors, and there has been, instances where, the vendor is just being so non-responsive that we as an organization to, decide not to use them and to go with someone else. Or if they've came back with, their security posture is just so low that, our strong recommendation is not to use them. Obviously, that comes into, a lot of, types of escalations and, dynamics around that into the the need or necessity of that vendor. But I mean, we do have. I think we're respected enough that if we have a strong opinion, then that business clinical area will decide to go with another vendor.
Right, and you use the term sponsor for the internal person that's requesting this app or
Mhm.
championing this app. And I would imagine that transparency can go a long way here in convincing that sponsor or helping them understand why, we don't recommend you go forward with this. Here's what happened. Here's where they're falling short. They may not
Yeah.
understand super technical level, but still, you want to you don't want to just say no, right?
Yeah.
You want to say,
Sure.
here's what's going on, and hopefully they'll say, well, now I understand. So we're going to have to look at someone else. You bring them on board with
Yeah.
your thinking
Yeah.
rather than just delivering a no from security.
Yeah. And it's interesting, the vendors that we do say no to, usually those business clinical areas have had issues with them as well. So I find it kind of goes hand in hand. If you're a bad vendor on the security side, you're usually a bad vendor from like a delivery standpoint, responsiveness. It just kind of runs the gambit like that.
Right, right. All right, very good. Let's talk a little bit about medical device security. I think if my research served me correctly, that was on your LinkedIn profile, that this is an area you have some experience. Obviously, a huge area. There's some regulatory stuff going on where they're trying to make the vendors behave a little better. I mean, it's a crazy area
Mhm.
because there's there's a tiny number of vendors that produce some of these pumps and these different things that
Right.
everybody needs.
Right.
So the buyer, in this case, even the largest health system, could have absolutely no sway, no power here. I mean, they're not listening to you and making changes. They're doing their thing, which is why it almost has to be at a level of government influencing this. But what are your thoughts around the current state of medical device security? What you see as far as going on from a policy point of view, what you like, and any advice you have for your colleagues here? This is an area people struggle with. It's almost like the identity and access management with permissions moving all over. Well, with this, you have devices moving all over,
Yeah.
and sometimes you can't even find them. But what are your thoughts?
Yeah. So one thing we did do is we weren't several years ago, we weren't good with tracking our medical devices or knowing what we have. And we put some pretty good scanning tools on the network that would detect these types of devices. So we did build out a really good inventory base and asset inventory on those. In terms of the security governance type, I think vendors are really seeing that you better be pretty tight around this area because there is a lot of influence and some policy creation coming from the government side. Uh, and I think most of the large vendors are pretty good in this space. Some of the smaller vendors, uh, we'll see things where they're still running, very, old operating systems, or they're embedded, so you can't even do patching on them. We try to work with the vendor, to upgrade those or to either isolate them. Uh, and it's all a risk decision too, right? And in terms of if you have a medical device, you know, in a locked room where only two people ever access physically, and it's it doesn't hold a lot of data, then it's probably something that we may not address. But
Mhm.
if it's something that is a much higher risk, I mean, we'll work with the vendor. If they, and then again, if they don't want to, if they don't see that as a benefit, I mean, we can always look for other types of vendors. I mean, there are some very specialized, uh, but usually you do have a close competitor as well. So I think that from a vendor standpoint, keeping up with good security hygiene is a selling practice too to customers.
It's certainly become more and more of one. Yes. You mentioned a risk-based decision. Now, as we know, that the folks in IT security are not making those decisions. They are ascertaining and discerning and figuring out the risk, and then they have to figure out how to communicate that risk in a non-technical way to a business person, an operations person who's usually going to be the decision maker, correct? I mean, you are there to communicate risk to someone who's going to decide about accepting or not accepting that risk. Is that correct? And what's your best advice for IT security folks in making sure they are translating that in a way business folks, even board people, can absorb it and make the proper
Mhm.
and be in a position to make a good decision because you've done a good job translating it.
Yeah, so I think it really depends on what the risk is. I mean, we do have influence if there's something that's such a large risk to the organization as a whole. I mean, we would have that authority to say no or heavily influence that decision as a consensus to say no. When it gets to some of the smaller risks, when we're going through those closeout meetings and through the risks, we'll have those individual decisions with the sponsors, with the project teams. And sometimes we're fine with risks being accepted, and we have a good risk tracking tool that they would be accepted risks. We would follow up with them either biannual or annually to make sure that they still are an accepted risk, whether we need to mitigate, whether it's even in the organization, it's maybe the application that they're using is no longer used, so that risk has gone away. But I do think it's really important to write them in a business clinical type of presentation. Whereas I try to really work with the team to keep a lot of that technical type of wording limited so that your point is coming across, but it is understood by the sponsors in the business areas.
And do you think that's sort of you could that's a maturation process as an IT security professional? For example, you're working with someone junior, perhaps mentoring them. That might be a typical
Yeah,
mistake. Is there's this is way too technical for the people we're going to go talk to in an hour, something like that.
it definitely is. It's a skill set, and it's something that you mentor and you work with people on. Yeah, I've seen some risk assessments that excuse me, that I read and I'm like, this is so technical that no one's going to understand this outside of that small area that you reviewed. So we do mentor the younger staff. We work with junior employees, security analysts to make sure that they're presenting in a certain way that a large audience can understand. And that's the same when we write policies. How I write an information security policy, and we work with our policy committee, is that you're writing this policy with the thought that the person reading it has never read it before, has no knowledge of security, but it's understandable for them what they can and cannot do. So it's the same with our risks, how we try to write those.
Very good. So your CISO, Glenn Stanton, did an interview and he talked about the experience gap. I guess some of the folks that are brought in, junior folks come in maybe out of college. Um, they obviously they have to get up to speed, so to speak. And one of the things he mentioned was I guess they have a hard time judging what's important, what's not important, right? What's a real risk, what's an issue versus what not. These individuals can sometimes lack the experience needed to be able to judge the appropriate level of controls for the appropriate level of risk and usability. So I am asking you to sort of react to someone else's statement, but it's your CISO, and it's kind of an interesting concept that again is part of the learning curve. And I
Mhm.
assume the how that manifests itself would be overreacting to risks that maybe are not a problem. But I guess it could go the other way, where they're underreacting to something that's
Yeah.
important. But your thoughts around that, and always with an eye to giving advice to your colleagues who are bringing on these same folks to their teams.
Yeah, no, that's a really good topic area. And one thing we really try to emphasize is that to an individual employee, you're part of a wider team. You have, so don't think that you need to be making these decisions on your own, especially when you're writing a risk assessment, you're going to finalize it. Always run this by another teammate, your manager, a person, another individual in the security area that has more experience. So I think having that type of almost like a learning type of experience as you're writing these really helps. But you're right. I mean, sometimes people will come in and they'll say, "Hey, this is a huge risk," and I think what we try to do is emphasize, look at it from an organizational impact, not
Hmm.
just that small area that you're identifying it in. Is it really a huge risk? And sometimes they'll be like, oh, actually, it's a very low risk, right? So
Hmm.
that's kind of that mindset. And you can go the opposite way too. It's rarer, where someone would come in and think it's a really low risk, but it's actually really high. But it could be when you're looking at it from an employee an organizational perspective. I think for an example, someone wanted to connect from they wanted to work remote from a different country, outside the United States, to connect to this application, and we said no, and they thought it was a very small risk. But from an organizational standpoint, we explained because of these reasons, it's a very huge risk. So they were understanding that.
Yeah, and I recall a conversation I had with another CISO. Um, it's important to understand context. So let's say you have an application that's being requested, a clinical application, and perhaps this is a really, really specialized application that's very unique
Hmm.
and super high value, and the clinical folks saying this is going to save lives. That creates a different risk context. You may be willing to accept more risk for something that these folks are saying, let's assume it's true, are saying is this is super important to patient care. So, right? Because so it's all in context. You have to
Hmm.
understand what's going on
Yeah.
with the application, which maybe is difficult for an IT security person, which is why you have to really understand operations. You can't
Yeah.
just be in a little silo. You have to understand what people are doing with this stuff. And the goal of the organization is to deliver patient care.
Yeah.
So, your thoughts there?
Yeah, no, I completely agree. And one of the things that we've really tried to do from our staffing perspective is to bring in really good people that are in other roles in the organization, and we see them, we work well with them. We see that they have a good risk mindset, a security interest, and then we bring them in, and then they bring in that clinical business knowledge into the group. I find that's really beneficial because if you're working at a healthcare system and all of your information security hires are from the outside and they've only worked in information security, you're going to miss a lot, and a lot of that operational understanding, a lot of that clinical understanding. So we've done a nice job. I say it's almost like a 50-50, where half of our
Hmm.
staff have been in other areas and we bring them in. And as long as obviously we're knowing that they're competent individuals, and they can learn the security side, but they bring in a wealth of knowledge. And then for some of the specialized security areas, we'll bring in specific individuals, external hires. But I do really like those internal hires coming in from other business and clinical areas.
Yeah. If you're going to have to talk to a well-respected and experienced physician about something they're not doing properly from a security point of view, you have to know how to have that conversation,
Yeah,
right? You're not going to send your junior person out of the basement to go yell at
right.
them. Yeah,
And we have physicians that work in the
yeah,
technology group. So if it's going to involve, it depends who it is, another
right.
physician, we'll bring them into the conversation and have that. So
Make it more collegial.
yes, exactly.
Yes, yes, that's awesome. All right, Glenn. I'm sorry, Trevor. I had Glenn on my mind. Um, I think that's just about all we had time for. Any final thought based on your experience, your career, best piece of advice for someone in your position at another health system, something that you feel has contributed to your success?
Yeah, I think just keeping in touch with people outside of your organization, being a member of different security groups, going to conferences. Whenever I go to a conference, I always I either talk to someone or I see some type of presentation of things that I never thought of. And there's so much new coming at any individual. You're not going to know everything. So really finding those great people that can work on your team, that you can delegate to, and you have full confidence that they're the expertise in this area. You're comfortable with delegating to them. I think is very important for anyone in a deputy CISO position. You can't do it all. You need those really good people to work with on your team. So I think really stressing that. I mean, that could even be the number one thing that will benefit you uh, for creating success in your organization is having great people to work with.
Great advice, Trevor. Thank you so much for your time today. I really enjoyed this.
Yeah, I appreciate it. Thank you.